I am Alyssa Mastroni, and I'm the Evaluation Data Manager at the Evaluation Center. The purpose of this video is to provide an overview of the State Opioid Response Grant and its federal reporting requirements. The Colorado Department of Human Services Office of Behavioral Health, OBH, is currently using federal grants from the Substance Abuse and Mental Health Services Administration, or SAMHSA, to help Coloradans access opioid use disorder treatment. Efforts began in May 2017 when OBH received $15.7 million from SAMHSA through the State Targeted Response Grant, STR. Funding for STR ended in April of this year. However, in September 2018, OBH received an additional $30.1 million from SAMHSA through the State Opioid Response Grant, or SOR. Several SOR activities will be extensions of the STR grant, and current SOR funding will end in September of 2020. Activities funded by the current SOR grant include prevention, treatment, recovery, criminal justice, and harm reduction activities. Because of STR and SOR funding, the following resources are also available. This includes the Opioid Rescue app, which is an app to help find opioid use disorder treatment, as well as providing steps to take if you encounter someone experiencing an opioid overdose. The Colorado Crisis Line, which is available to call, text, and chat online, or receive walk-in services when experiencing a mental health crisis. And the Lift the Label campaign, which works to reduce stigma around opioid use disorder by sharing messaging, educational materials, and other resources. Please keep these resources in mind as you work with clients receiving treatment for opioid use disorder. You may find links to each of the resources on this slide. All grantees receiving federal funding, such as the SOR grant, are required to comply with the Government Performance and Results Act, which requires all federal agencies to set long-term goals and objectives, as well as specific near-term performance goals. As part of this federal mandate, all SAMHSA grantees are required to collect and report performance data using approved measurement tools. Therefore, in compliance with GPRA, the Act, the SOR grant requires the completion of the CSAT GPRA Client Outcome Measures tool. For the rest of this training, I will refer to it as the GPRA tool or just the tool. Data collection using the tool is completed through interviewing clients receiving SOR-funded opioid use disorder treatment services at multiple time points during their treatment. This data is entered and reported entirely through SAMHSA's Performance Accountability and Reporting System, or SPARS. Please note that there are other training videos that are available on the SOR Colorado website that go into detail about the tool itself, the data collection process, as well as tips and tricks related to the GPRA data collection efforts. Now that you know what the GPRA tool is, you may be wondering what work under SOR or SOR requires the GPRA tool to be completed. Data collection is required for all clients receiving SOR-funded treatment services. Client participation in the interviews used to complete the GPRA tool is ideal but not required for the client to receive SOR-funded treatment. If a client does not consent to participate in the GPRA data collection, providers will still need to provide a count of refusals. The managed service organizations overseeing the subcontracts to the opioid treatment programs will be providing a tracking tool that will count the number of clients who have refused to participate in the GPRA data collection. If there is a large number of clients refusing to participate in the interviews, this count, which will be reported to SAMHSA, will provide feedback about barriers related to the administration of the tool. We do anticipate that most clients will consent to participating in the GPRA data collection. After receiving client consent, all clients receiving treatment from the following services will be tracked using the GPRA tool and SPARS reporting. This includes clients receiving services from mobile unit services, medication-assisted treatment services to indigent populations or individuals who would otherwise not have access to treatment, residential treatment services, and for hospital transitions to residential services for clients diagnosed with severe infections due to intravenous drug use. It is also important to know what work under SOR does not require administering the GPRA tool. Any client who began receiving services originally funded under STR and continued treatment with SOR will not be required to complete the GPRA tool. Additionally, since the new updated GPRA tool was not available when SOR funding began, all clients who were admitted to SOR services prior to the new GPRA tool being available will likewise not be required to participate in the tool. The reasoning behind both exceptions is that the intake GPRA tool, or the initial interview, is meant to be used as a baseline measure for clients, which is then compared to the data collected in follow-up interviews. An intake GPRA tool completed for clients who began treatment prior to SOR funding, or for clients who had already started treatment prior to the release of the updated tool, would not report a true baseline. Individualized placement and support services, although funded through SOR, will also not require the GPRA tool administration. Thank you for watching this video. Please note there are additional resources available on the SOR Colorado website, including training videos on the GPRA Client Outcome Measures tool, the entire GPRA data collection process, including information about how to gain access to SPARs, as well as a video on various tips and tricks that will help you complete the GPRA data collection more efficiently. If you have any questions, please contact us at gpra@sorcolorado.org.